دكتورة شويكار محمود عبد السلام، أستاذ في قسم الميكروبيولوجي. محاضرة النهاردة عن الليبتوسبيروزس. This is our lecture today, leptospirosis. Leptospirosis is a zoonotic disease first described by Adolf Weil in Germany. He described an infectious disease characterized by jaundice and nephritis. Then come the further identification of this disease. The most severe manifestation of leptospirosis is a syndrome of multi-organ infection known as Weil disease. Description of Leptospira, which is the constitutive organism of leptospirosis or Weil disease. It is a gram-negative spirochete, tightly coiled spirochete, have pointed ends with either or both ends are bent to give a hook appearance, as you see here. It is highly motile by two axial filaments. It is divided into two species, pathogenic one strains Leptospira interorganans, and the saprophytic species Leptospira biflexa. It is isolated from the environment. Culture of this organism, culture characteristics of this organism. When we talk about the culture characteristic of any bacteria, we classify these characteristics into oxygen carbon dioxide requirement, temperature, optimum temperature, and the media on which this organism and grow. And so these organisms are obligate aerobe. The optimum temperature of growth between 28 and 30 degrees, can grow in simple culture media but enriched with vitamins like vitamin B2 and vitamin B12, long chain fatty acids, and ammonium salts. The growth of Leptospira is often slow. On first isolation, it takes up to 13 weeks. يعني أول ما بنزرعها من السبيسيمن بتاخد 13 أسبوع. كويس؟ But pure subculture, when we get this organism and do subculture for this organism, in liquid media it grows within 10 to 14 days. A reservoir, this organism, pathogenic strains, Leptospira interrogans, live in wild animals and in domestic animals, and particularly rat, horse, cattle, fox, and pigs, and so on. They grow in this organism asymptomatically in the renal or kidney tubules. A spirochete can also live in streams, rivers, and lakes. When these animals are infected, they may have no symptoms of the disease, but they continue to excrete this bacteria into the environment continuously or for some time, a few months to several years. And by this way, the human get infected. As you see, these are wild animals, rodents. They excrete urine in the soil, water, and vegetations, and human get infected by contact directly with these animals, or swimming or walking in water, and so on. Transmission of Leptospira. Human can become infected following contact with urine or other body fluids, except saliva, from infected animals. Either direct contact with the urine or excreta of these animals, or contact with water or soil or food contaminated with the urine of infected animals, or maybe by drinking contaminated water. Person-to-person transmission is very rare in this case. This organism is excreted in urine. And so these are the different modes of infections by this organism. As you see, rodents, domestic animals like this, excrete in urine. A person gets infection by this. So humans who are high risk of getting this organism, those who are in contact with animals, butchers, hunting, farming, especially in rice farms because it needs a lot of water. Farmers, water sports, fishing, bathing, and swimming in these lakes and pools. Occurrence, it is worldwide except in polar regions. This disease is an occupational hazard for rice and sugarcane field workers لأن الفيلدز بتبقى لازم flooded with water which is liable to be contaminated with the excreta of these animals. Farmers, fish workers, miners, vet workers in animals, dairies, and so on. Outbreak can occur due contamination of the canal or lake water by these animals. ADL distribution of Leptospira, it is present all over the world, as you see. And these are the risk factors. Pathogenesis and pathology of this organism. Leptospira is thin and motile. It can penetrate intact mucous membrane and enter through invisible cuts and scrapes in the skin. يعني it can enter through the intact mucous membrane but cannot penetrate healthy skin. There must be fine cracks or cuts in the skin through which the organism enters, and it reaches to the tissue by the corkscrew movement of this organism, motility of this organism. It passes through tissues and then go to the bloodstream and multiply in various organs, damaging the cells lining the small blood vessels, and it causes a fever. It is a gram-negative, and so it triggers fever. When it infects the liver, it causes jaundice, kidney, causes uremia, it causes multi-organ failure, severe form. Lung causes hemorrhage in the lung and hemoptysis. It affects the central nervous system, causing aseptic meningitis. Eventually, the bacteremia resolve and the spirochete live only in the kidney. As the disease progresses, the spirochete are excreted in urine. The flow chart represents the pathogenesis, how the pathogenesis of this organism. It enters through the skin and mucous membrane, enters through the blood stream, enter into the inner lining of the blood vessels, spread to all organs of the body, cause ischemia in different organs, as you see. Let's come to the clinical picture. Incubation period range from 2 to 20 days. The clinical presentation is biphasic. It has two phases. The first phase, early, non-specific, bacteremic phase, lasts for a week. It is represent the period between the entry of this organism until it reaches the tissues and in the bloodstream. High fever, chills, headache, myalgia, anorexia, nausea, vomiting, non-specific. Abdominal pain, constipation, remission lasting 2 days. During this phase, Leptospira can be cultured from CSF and blood samples. A urine culture is negative. So I can isolate the organism during this period from the CSF and blood. Then come to the second phase, we call it the immune phase with complications. Here it is the stage in which the organism reaches different organs of the body. In the liver, cause hepatomegaly and jaundice. It causes bleeding into the skin, mucous membrane, and lungs. Affection of the kidney, leading to albuminuria, microscopic hematuria, renal failure. Affection of the heart, shock, myocarditis, pulmonary edema, CNS involvement causing meningitis. It can cause eye involvement leading to subconjunctival hemorrhage and iridocyclitis. This figure represents the different stages of the disease and the affection of different organs. This is a small flow chart to remember you of the different stages. This figure represents different stages of the disease. الأكيوت phase, البكتيريميك phase هنا بيبقى فيه high fever. I can isolate the organism from blood and CSF. The antibodies still does not appear in this stage. I can do culture from blood and CSF. Serology, maybe at the end of this phase, starting by IgM. Then the convalescent stage, and this is the immunogenic stage, maybe after months or years, affecting different organs. Case fatality rate, it is rarely fatal, but it is may have complications, and mortality is absent in anecteric leptospirosis. Causes of death: organ failure, renal failure, myocarditis, adrenal failure, cerebral artery thrombosis. Differential diagnosis: the first stage, which present with fever, any disease like other diseases causing pyrexia of unknown origin, like typhoid fever and brucellosis, and they have the same risk group. Other presentation is jaundice, like dengue fever, viral infections, influenza, and so on. How to diagnose this case? First, direct detection in the specimen by microscopy, dark field microscope, to see the characteristic spirochete. Histochemical staining. These are sensitive in the first week. I can do culture on special media for isolation of this organism. In the bacteremic phase, I can isolate it from blood or CSF or urine in the immune phase. Nucleic acid detection by PCR in body fluids. Indirect diagnosis by the detection of an antibody, four-fold rising tree, or detection of IgM by ELISA in early case. This is a simple chart for a different diagnostic approach for the diagnosis of leptospira. Treatment: oral doxycycline 100 milligram twice daily for 7 days. طبعا for pregnant and lactating females, or those who have hypersensitivity to doxycycline, they can take oral amoxicillin or azithromycin. For severe cases, I give injection, ceftriaxone or cefotaxime or penicillin G is given. Prevention: educate the public on the mode of transmission, to avoid swimming in potentially contaminated water, and to use proper protection when work require such exposure. يعني الناس اللي بيشتغلوا, those who work in the sewage and lakes and farmers, to wear boots, for example. Protect worker in hazardous occupation by providing boot, gloves and apron. Recognize potentially transmitted water and soil, drain such water when possible. If I know that a lake is contaminated by this organism, I have to dry it and so on, and treat it. دي بروشورز بتطلع تنبه الناس ان هم how to avoid leptospira. Don't swim, swallow flat water او الووتر contaminated. لو عندهم اي كات او سكراتشز، البوتشرز او الفيتس او الناس اللي بتتعامل مع الانيمالز والانيمال اكسكريتا، دايما يكفر الكاتس بتاعتهم او السكراتشز، لان ده ممكن الاورجانيزم هيخش. يلبسوا بوت بيشتغلوا في الليكس والحاجات دي والسيوج. بريفنت رودن، طبعا ان الرودنز توصل للاكل بتاعهم. وبنعرفهم الايرلي سيمبتومز اوف ذا ديزيز. دي بروشورز مثلا منزلها CDC بتبقى. نعمل كنترول اوف رودنز ان هيومن هابيتيشنز، سواء كان urban او rural او other areas. Infected domestic animals, I have to separate them because they excrete this organism in urine and contaminate different areas. Immunization of farm and pet animals prevent illness, but do not necessarily prevent infection and renal shedding. يعني هو الفاكسين بياخده علشان الديزيز ما يبانش عليه يبقى سيمتوماتيك، بس ممكن يحصل انفكشن ويبقى اسيمتوماتيك، وقلنا ان هو بيفضل في الرينال تيوبيولز وكونتينيولي شادنج. ممكن immunization للناس اللي هم liable للليبتوسبايرا. ممكن في كيمو بروفيلاكسز من الدوكسيسايكلين، الناس الاكسبوجر عندهم هاي اكسبوجر ريت. ولما يحصل كنترول بقى، لما يحصل cases of الليبتوسبايرا ببلغ الهيلث اوثوريتيز isolation of this organism و disinfection of الارتيكلز contaminated و treatment of cases investigation الكونتاكت والسورس اوف انفكشن. لما تيجي حاله ليبتوسبايرا المفروض ان احنا بنعمل investigation للكونتاكت والسورس اوف انفكشن عشان نعالجها ونعمل لها decontamination. شكرا.